Good evening, everyone. We are going to discuss today in FCPI Research and Publication Forum FCPI webinar. We are going to discuss on use of surveillance epidemiology and end result database in research and publication. And the session is taken by Dr. Mohammad Zubair. He is a PhD graduate assistant in Department of and Administrative Pharmacy, University of Georgia, College of Pharmacy, Athens, Georgia. So I would like to invite Dr. Zubair, and it's a proud moment for me to invite him as he was my student earlier and now he's doing his PhD in University of Georgia. So as a teacher, it's a proud moment for me. And Zubair is pursuing his PhD in pharmaceutical health services, outcome and policy with a specialization in oncology research. And he is a good expertise in systematic reviews, meta-analysis, pharmacoepidemiological research, and health economics. And he have good publications in internationally reputed journals, and he presented many of his works in some of the best conferences like ASCO, and he's received many scholarship for that. And he was working with many good claim databases like MarketScan, SEER databases, and other reputed databases globally to learn the outcomes in oncological research. And currently, he serves as the president of ISPER student chapter at University of Georgia. So with this brief introduction, I welcome Muhammad Zubair to the session, and I hand over my session to Zubair. Thank you, Zubair. Please carry on.
Yes, yes. Thank you so much, Dr. Rashid, and the entire team of FCPI for inviting me to talk to you today. So, good evening, everyone, and good morning to Dr. Rashid. So, today we will be talking about the use of surveillance epidemiology and end results database in research and publication. So, how we can use this database to publish our manuscripts, or how we can use this database to see what are the cancer statistics. So in my talk, I will be having this talk in two parts. The first part, I will be giving you a brief background on what is SEER database and introduce you to the SEER database. Then I will walk you through how to get an access to SEER database. And finally, I'll be having a brief hands-on demonstration on how to extract the data using SEER stat software. So these are the topics that I will be briefly touching upon. So I will cover the concept of the secondary data analysis, and then I'll introduce the SEER database, discuss its application, and share examples of research which was conducted using the SEER data. And finally, we will also have a look at its limitation and conclude with a hands-on demonstration. Um, before talking about the SEER database, I would like to take a few back and introduce you to what is secondary data analysis. So, I know many of you might have already been aware of these, but I would just like to brush upon what is secondary data analysis. So this refers to using the pre-existing data which was collected by some other entity for the research purpose. So this entity can be a government organization or a hospital registers, anything like that, or a public health initiative which was funded by the government. So they will collect the data for you. You will just download these data sets online, which are most of the database are available publicly. You will clean the data and use these data to answer research questions which were developed by you. So there is a lot of advantages of using the secondary data analysis. For example, if you are conducting a primary research by yourself, so you might have to develop a questionnaire based on your research question, then you get validated. You get the questionnaire validated by doing a pilot research or consulting the expert in the field. Uh, so you don't have to worry about all of these things. Only thing is you have to know how to clean the data, and you have to clean the data based on your inclusion criteria, and you can analyze this data and produce the results in your manuscripts or abstract or whatever the result outcome you would like. So in that way, the secondary data analysis like saves a lot of time, resource compared to the primary data collection. So it also provides you with an opportunity to explore large data set and contribute new insight to the scientific knowledge. Which would otherwise remain unexplored. So all of these has been taken from a Jacobson introduction to health research methods. And these are the few examples of publicly available data set. So we will be talking about SEER today, but I would also like you to introduce to these other data sets that you can use in your research which are publicly available. So today there is a lot of data sets that are available. We might have to be aware of what variables that data sets have and what population and what are the outcomes these data sets are looking into. So you can use it for your research interest and explore what is there in that data sets. The first one is enhance. So this is one of, again, widely used data, publicly available data sets, which collects the health and nutritional data through physical examination, clinical test, and interviews. The second one is NHIS, which collects information on broad range of health topics through personal interviews. The third one is BURFIS, which is Behavioral Risk Factor Surveillance System, which tracks health related risk behaviors, chronic health condition, and preventative service use. And it also provides and finally, the one which we are talking about today is SEER, which provides the cancer statistics to reduce the cancer burden in the United States. And finally, the other database which we are more familiar with is the FAERS database, which is FDA Adverse Event Reporting System. So this tracks medication adverse events and medication error reported by healthcare professional or the public or the regulatory agencies. So this is a mandatory, the step of reporting the adverse event is mandatory for the regulatory approval. So those are few examples of the publicly available data sets that you can use in your research. But today we are going to talk about SEER dataset. The SEER program is funded by National Cancer Institute. It was funded since 1973 and it started in 1973. It collects cancer data to help reduce the cancer burden in the United States. So it initially started covering 5 states of the United States, but since then it has been expanded to cover numerous additional areas with almost all the states that you can see in the figure. So it is one of the important database as far as cancer is concerned, and you can use this data to explore and publish the results that you would be interested in. So talking about the overview of the SEER database. So it collects and publishes the cancer incidence and survival data, and it covers approximately 48% of the US population. So it becomes a representative sample of the overall United States population. So there are numerous variables that are available. For example, it has the patient demographic details such as age, sex, race, and different ethnicity and marital status. And it also has the information on the primary tumor site and tumor morphology. Uh, it also has the variables that are related to stage or diagnosis, and there are multiple ways of staging, for example, AJCC staging and TNM staging. So you can always use the one that is that you would like to use and which fits your research question and answers it. And it also has the first course of treatment, but there is a limitation into it. So, for example, you might get a variable of treatment, and the treatment will be classified into whether or not the patient received the chemotherapy, or he received a surgery, or like the radiation. But if you want a specific treatment information, such as what is the like overall survival of patients who treated with pembrolizumab in NSCLC stage 4 NSCLC patients, so you might not get these variables because it is not as specific as that. There are other linked databases that you can explore if you want to answer such research question, but for today's talk and today's publicly available data set, it does not have that variable. So if you want to know the specific treatment related outcomes, such as the X molecule, it might be anything. So you might have to link this SEER database with other database which are available, which is Medicare, but it is overall the subscription based, but it is not freely available. So there is a ton of data available, freely available data that can be used to answer different research questions, which you can explore and put it in your like research. And there is also the follow-up for vital status. You can do survival analysis, and you can see survival of patients with stage 4 breast cancer with different metastases or different histology. So you can compare the overall survival with all of these. So talking about the geographical coverage, the data collects almost from 22 US geographic areas, and it is a diverse population. So it is a representative sample. So whatever the results that you're getting is the representative of the entire population of the United States. And at the end, like SEER offers a wealth of cancer statistics, including the incidence, survival, and prevalence of data. So let's talk about who uses SEER data. So it is not restricted to any researcher. Anybody can use this because this is a publicly available de-identified database. So the patient confidentiality is well preserved, so you don't have to worry about that. So the researchers, clinician, public health official, and policy maker use SEER database to inform their work, and it definitely supports the evidence-based decision making in healthcare. So as a researcher, you can use this publicly available data no matter where you are from, unless you have a valid email address. So talking about the research opportunities, how are the SEER data used? So it can be used to evaluate the cancer prevention and screening programs and quality of cancer care. And definitely, it can document the disparity by race, ethnicity, gender, geography, and other variables. For example, if you would like to see what is the overall survival of patients who are in specific economic status, for example, who are earning so and so amount of money. So sometimes this can decide the patient outcome, because it will decide whether or not a patient can afford his cancer treatment. So it is one of the drivers of health outcomes. So you can also explore the cancer outcomes in different economic conditions. So this again is one of the wonderful variables that you can also include in your research. And you can use this to demonstrate the effectiveness of public health intervention, which was introduced by a government agency or something like that. So it also guides the translation of research into health policy and practice. So again, SEER data are very wonderful resources for trend analysis, policy developments, and resource allocation among several other purposes. So next, research opportunities. So what research opportunities are there using the SEER database? The key research areas that you can focus on using SEER database is the cancer trend and the pattern of different outcomes in different cancers. So you have the cancer outcome data of different and very large. This is very large data set. You can find it for every other tumor. So you can use it for looking at the cancer trend and pattern. And if you are someone who is very interested in survival analysis, this is one of the best database for you to just start and doing some survival analysis using Kaplan-Meier method or different methods and looking at their outcomes. So you can also explore what are the impact of the different demographic factor on cancer outcomes. And you also can explore the disparities in cancer care based on different socio-demographic factors or social determinants of health. So in Indian context, of course, like you can potentially compare this results that you're getting from SEER to the Indian cancer registries. I think they are developing a lot of registries now. You can certainly explore looking at what is the trend and what are the different and compare your results with a different population. And of course, you can collaborate with any other researcher who are involved in using these type of data sets, and you can learn from them and you can be a part of their research team and publish the results. And Again, SEER data enable research in areas like cancer epidemiology, survival analysis, and treatment effectiveness. But there is a caveat. So treatment effectiveness cannot be seen for a specific molecule. Rather, it can be seen only for surgery, radiation, or chemotherapy for this population. So there are numerous studies published in high impact factor journals. So I was just I was just trying to show you the emphasize you that how many researchers has been published using SEER database. So I just put in this SEER database in the PubMed search. And then I got almost 11,000 results. And if I restrict that to the last 1 year, I have almost 1,300 results. So this shows that this database is one of the most widely used, and it is not only used by the researchers in the United States, but throughout the world. And so you can always explore this database and try to include this in your research if you are someone who is in your fifth PharmD and looking at the different database to use. So you can talk to your advisor and include these database in your PharmD thesis if they allow you to do that. So these are the examples of few researchers that I took the screenshots, which use the SEER database. So you can see that there are a lot of researchers. These researchers are not only from the United States, but from the outside. You can also see a study from India. So impact of changes in treatment paradigm on survival in oral squamous carcinoma, a population level study. So these are all some of the examples that shows that There are numerous high impact studies that have used SEER data, demonstrating its value in advancing cancer research. So, this is another example of what has been done using the SEER database. The title of this study is The Clinico-Pathological Features and Survival Outcomes of Patients with Different Metastatic Sites in Stage 4 Breast Cancer. So, in the abstract, you can see they have used the SEER database and they have looked at the survival outcomes of stage 4 breast cancer patients according to different metastatic site. So they extracted almost 18,300 patients for the survival analysis, and they categorized the cohort based on the metastasis. So there are patients with bone-only metastasis who were almost 39%, and there are patients with multiple metastasis, which was 33, followed by lung metastasis, liver metastasis, and other metastasis. So they have defined the cohort, and if you see the results in the Kaplan-Meier curve, they have compared the survival outcomes between the different metastatic sites and what are these, and they have some good follow-up period of almost like 70 months. So these database is very large and can be used for a lot of research questions specific to oncology. Then next, talking about the challenges and limitations. So there are few challenges and limitation of using this data. So there is a limited clinical detail. For example, the treatment regimen, as I said, you cannot see the specific outcomes for the specific treatment, for example, paclitaxel or any other treatment. Rather, you can look at it by the entire group of it. And there is a little information on the biomarkers, but there are a lot of variables that have been included. For example, we can also explore on the different histological types. That can be one of your research question, like what is the survival of so and so cancer patients with so and so histology. So you can always explore that. And there is a lack of real-time updates and the challenges of applying. So basically, the population characteristics might be different. The might be different in the United States compared to India. So it might be a bit challenging to apply these findings to Indian population, but you can certainly use this database to answer the research question. So there are a few other limitation. For example, there is incomplete treatment information and lack of granular socioeconomic data. So this makes it a bit challenging. Yes. So coming on to how to access the SEER data. So as we see now, like there are two data products which are available. One is SEER Research Data and SEER Research Plus data and NCR data. So as a researchers, the first product, which is SEER Research Data, is free for any users with a valid email address, whereas the Research Plus data is for someone who have ERA Commons and HHS account. For now, we should not worry about the Research Plus data because you have a plethora of data which is available in the research data, which can be used and answer a lot of research question which is publicly available. There is a few variables that are not included in SEER research data when compared to SEER Research Plus. Some of them are, it excludes the geography, month in addition to the year of diagnosis, and other demographic fields are not there, which can be able to, which is not so important data for us. So you can use only research data for any of your research questions that you have. So how to get an access to SEER research data? So there are two steps in it. The first step is you have to apply for the research data access by registering in the seer.cancer.gov. So I will be walking you through the screenshots in the next few slides. So you will register and you will complete the application form. So you will receive an email. You have to acknowledge three forms and agreements. So once you do that, you should submit a form. Then you will receive an email with a link to verify your email address. Once you verify that, you will get your confirmation email from SEER program to process your request, and you will be given the access to SEER stat account. So this account is very important for you to access to the SEER stat. So SEER stat is a software which is used to extract the data of SEER research data. So you have to go there and install your SEER stat and then get the research data to analyze it. So one thing here, if you're a Mac user, you won't be able to use CSStat in Mac. It requires a Windows application. So you might have to use a Windows application for this. If you are a Mac user, then you will be having your own credentials with your login ID the and your password. So this is how you will click or type this link, which is seer.cancer.gov data access. So once you do that, you will be directed to this page. In which there is a link called data request form. Once you click that, you will be prompted to another page which looks like this, and you will request to uh, research data, not the research plus. So once you put your email address, you will receive an email with your for the verification. Then once you do your verification, you will receive an email from SEER program with your SEER stat credentials, like your username and password. So this is about how to get an access. And now I will be running you through how to extract the data using CSStat software. So I will exit my screen and share uh, screen so that I can show it to you on how to use CSStat software. So Dr. Rashid, if you can let me know if my screen is up with the CSStat software.
Yes, Zubair, your screen is up with CS.
Yeah, yeah. So once you get your access to CSStat software, so you will download it in your like the Windows, and then this is how it looks. The SEER stat environment looks. So it is currently SEER stat 8.4.4 version. So you will get an update based on the time that you are using this. So these are different things that you can explore. So these are already calculated statistics that are available for different cancer. But as far as you are looking to do your own research, case listing is something of very importance, and this is how you can download the individual patient level data. So once you click on this, you will be prompted to you will have few pop-ups. Just say hit no, hit yes, okay. Then these are different cancer registries that are available within the data. So you have 8 registry. This shows that the SEER database has been evolved over the time. So initially it had 8 registries, then they keep on adding. So for now demonstration, I would use like incidence year research data, 17 registries. So it has data from 2000 to 2020. So once you select that, so if you want to know about what these uh, relates to, for example, incidence year research data 17 registry or anything else. So feel free to go to the seer.cancer.gov and read the data dictionary, wherein you can find what are these referring to, and you can also get the information on what are different variables that are there and what are the different level of the responses you have. So that is how you can do it. So once you select the incidence year research data, then you have to click on selection. So once you do that, you will automatically see that you have malignant behavior clicked and known age clicked. So I would let this be like that, and I would click on edit. So once you click on edit, this will allow you to choose the data that you would want. So you can see that you can restrict the data, restrict your data based on the age at diagnosis, race, sex, uh, and different morphological side. For this example, I would be using the lung cancer data from. So once you click on site and morphology, you will have the values that you would like to choose. So these are different tumor sites that you can extract the data. So this is completely based on the research question that you have and the population of interest to your study. So for now, for demonstration purpose, I would be using lung and bronchus cancer. So once I select that, you can also use different variables to restrict the data, because this is very huge database and you don't want to use like the heavy data, which is like a lot of gigabytes. So I would restrict the data of my interest, and not I would just exclude the other, because when you are handling these huge data, it becomes a lot of efforts in order to handle this. So I will be more cautious to use heavy data files, and restrict as much as I can in the initial stage of the downloading of data. So now you can also restrict the data based on your age. For example, I would like to exclude all the patients below 18 or 19 years. So I can choose patients who are aged like from 20 years to 85 plus, and then I would hit OK. So then now you can see the selection of patients. You have selected lung and bronchus cancer, and who are like 20 years and older, and then you will go to table. So once you go to table, these are the variables that you would like to have for your data sets who are lung cancer patients who are 20 years and older. So of course, I would like to have the basic demographic details such as age. So I will select age and hit column. Then I would like to have the sex variable, then year of diagnosis, and then the race recode, and then the site and morphology. So you can use whichever you want. So, and then I would like to have the um, summary stage. So you can have combined stage. So it's all based on your research question, and I would definitely want you all to explore the studies that have already published and look at their methodology of how they have used and what variables they have extracted to analyze the data based on their research question. So in that case, you will be having an idea of what variables that you would like for your study based on the available literature. So if you click on therapy, you can again select the summary cancer surgery primary site. You can have that variable. And if you are someone who is doing the survival analysis, cause of death and follow-up is something is very important for you. And you can include all of these variables, so you can see what was the survival of that specific patient at the follow-up of until 2020. So you can have all of these. So SEER cause specific death classification is something that is very important variable. It says whether the patient died because of the cancer or any pre-existing comorbidities. For example, patient might have cancer, but he might have died because of the cardiovascular disease that he already has. So these variables are very important if you want to specifically look at the cancer specific survival, not all cause mortality rate. So if you're someone who is looking at all cause mortality rate, you can always use different variable than the cause specific mortality if you are looking at the cancer specific death. And these are different variables that you can extract and um, explore. So you can also see what was the median household income. So you can also like have this variable in your data set, and whether or not the patient was from rural or urban. So you can have this also, which can also be another driver of health outcomes. So once you select all of these variable, it can be anything based on your research question, but just for demonstration purpose, I have chose few of them. And then once you do this, you'll go to output and you will put any of the title you would like to have for this data set, and then you will click on execute. Once you click on execute, you will find you will get few pop-ups. You may have to record this because you might have to tell the information in your methodology. So just for your information, just keep this in mind. So what variables you're selecting. Once you give hit all of these, so you will be prompted to these gets downloaded. So there are almost 100,000 patients, so it will take a few minutes. So I would rather use already downloaded data to just show how it looks. So basically, this is how you select your patient population and the variables that you would like to explore. And then I'm canceling this so that we can use, I have already downloaded data that can be used. So Dr. Rashid, can you see my data sheet?
Yes, yes, it is visible.
Yes. So this is for one of my projects that I downloaded recently. So this is the endometrial cancer patients who from almost 2000 to 2020. So so in this, you can see there are a lot of variables and a lot of data available. So there is a huge data set. This is just for like the endometrial cancer patients. So these individual like rows correspond to individual patients. So you can see this patient was 60 to 64-year-old female diagnosed with cancer, endometrial cancer in 2019. And this was the race and the origin. And so this was the histology and behavior of the cancer. And then so and so on and so forth, you can see different variables and include as you want. So there are also like the combined stage summary. You can see whether it was localized or it was regional or it was distant meaning it has already metastasized. And you can also see the stage group. For example, this patient was stage 3C1 and this was 1A. So, and like you can explore all of these while you're playing with the data set. And these again, so this is whether or not the patient had bone metastasis. This is yes or no response, so binomial outcome. So you can see the different metastasis, for example, as I said earlier, bone, then brain, liver, and cancer. So for the paper that we talked about in an example, these variables are something that you would definitely like to explore and see whether or not the metastasis make an impact on the survival. And then also you can see other whether the patient is alive or dead or what is the cause of death. whether the death was attributable to cancer diagnosis, which is available in the SEER cause-specific death classification. So these are all the variables that you can definitely explore. This is one of the important variable if you are looking at the median survival or the Kaplan-Meier, for example, survival months. So this is something which is important. And again, this is the patient ID and then the median household income. So what was the household income of that patient? So basically, you can have a lot of variables and for different type of cancer for you to explore. So feel free to go and check. And there are a lot of resources available in the YouTube as well, which can be used, which is from the National Cancer Institute itself, which can be used. So feel free to go back and go to the seer.cancer.gov and explore this database. And I will be going back to my slides.
Yes, Zubair, your screen is visible.
Yeah,
You can go ahead with the presentation mode.
yeah, yeah. So now we saw a brief demonstration. Like this is a short time, so I thought of demonstrating it really quick. So yes, this is how you can use this data set to answer your research question and download different variables and for your research population that you would like to explore. So in conclusions, like this is a very critical resource for cancer research. If you are an individual who is looking out for doing a lot of research in cancer, this is a very useful resource for you to explore and use it in your research. And as far as IRB is concerned, this is a de-identified database. You have to submit an application, but you will get an exemption. So you have to do your application for the IRB approval. And as I said, it is very critical resource for cancer research, which offers an extensive data to inform public health efforts. And you can do a lot of research, both population based or individual level based, for epidemiology, survival analysis, and treatment research. Of course, there are a lot of limitations with this database, but with that, you also have a lot of advantages that can give you the ready data. So you just have to be aware of the variables that is available in the documents in seer.cancer.gov. You will go through the variables and you will clean the data using your inclusion criteria. And while you're also using this software, I would love you to have a very good experience or very good expertise in any one of the data analysis tools. For example, it might be SPSS or R or SAS or Stata. So whichever the data analysis software that you are good with, you can use it to analyze the data. But I personally use R. So feel free to use this. And of course, you can also export this data in Excel format or text format, and you can play around with it like the way you want. So if you have any questions, I would love to answer those. So, and if you also have question and if you have few doubts, you can always reach out to me in my personal email, which is on the screen. And you can also connect to me on LinkedIn, asking if you have any questions or doubt related to SEER database, and I'm happy to help. And yes, so thank you so much for listening to me from past some time. So again, I appreciate Dr. Rashid and the entire team of FCPI for inviting me and giving me this opportunity to talk to all of you on the Sunday evening. So thank you. Thank you all. any questions.
Yeah. Uh, Thank you, Zubair, and
Yeah.
thank you so much for being with us. Almost 45 minutes, last 45 minutes, you were giving a wonderful lecture on
Yeah.
use of SEER database. And I would like to, if we can, off the screen, then we can have a face-to-face interaction. Then,
Okay. You want me to stop sharing my screen?
yep.
Yeah. Thanks.
Thank you so much. Yeah. Yeah, it was a wonderful presentation, especially on such a topic which is very interesting and it is very naive to the Indian students, as you know.
Yeah.
Exactly. That's the importance of why we picked this particular topic to be discussed. And yeah, you have given a wonderful overview of starting with the base, like what is a secondary research and what are the different databases which we are using in our clinical research, basically, or outcome research, what we specifically say. So yeah, maybe few of our Indian students might be familiar with the FAIRS database, which you are
Yes.
discussed, because as you are aware, and we conduct many disproportionality
Yeah.
analysis using the FAIRS database. As you know, there are multiple methods, and you are good in that. I'm very sure that you
Yeah.
are good in disproportionality analysis and conducting systematic review of that. And then you given a full power pack, complete overview of SEER database along with what is the purpose of SEER database and what it contains, what are the different information which we get out of it, and how we can customize the data which we need according to our research. Then you discuss what are the different opportunities, and it was very good that you have given an awareness that it is, though it is a US database, it is not only for US, anyone across the world, especially from like a country like us, where we don't have a already established database. It
I think I can't hear you, Dr. Rashid. I'm sorry. Nope.
can you hear me now?
Yes.
So
That's
it
perfect. Yeah.
because your phone. Okay.
Yes.
Okay, perfect. So you given a good discussion on how the SEER database can be used by an Indian students, and you
Yeah.
give a full opportunity for the students to start with their research, because that's very important. I'll come to that in later. And then you said that what are the Indian studies which you used? You given some examples of Indian studies and other studies across the world. They used this particular SEER database. Then you told what are the different challenges and limitations, and what is that, given some glimpse on how we can tackle it. Then you discussed on how to access it, and the best part was that you given a hands-on demonstration how to use it and how to analyze it. So it was a
Yes.
wonderful presentation, last 45 minutes, and I really enjoyed it. And hopefully our audience also might have got benefited, and at least in the future somebody can use that database. So I have a quick one or two questions,
Yeah.
like yeah, and the best thing is that you did your PharmD from India and you came over.
Yeah.
Yes, and in between, I know that you were working with Eli Lilly as a medical writer as well. So you
Yeah.
got good amount of opportunities to work with academia, industry, then come back to industry. So you had a good transition there. So I know that very well when you talk about the Indian students, or not only Indian students, Indian researchers, I could say, okay,
Yeah.
PhDs and those who work in the research, uh, they are not much familiar with the databases, especially the claim
Yeah.
databases. It's not completely a fault. It's we don't have the opportunity, means we don't have a already well established database in the Indian settings, and we are not that aware of what the databases across the world. So during your journey, can you just share an experience not on You know that how much we are using the database here in US for any
Yeah.
to take. It's the one of the main platform is any database. So uh,
Yeah.
what was your experience and what message you need to pass into the Indian students or Indian researchers on how using this database will be beneficial in their research career or in their future journey?
Yeah, so that is a really good question. So, uh, I would have been loved to be a person who was involved with FCPI and to hear somebody talking about the cancer database because from the time I was doing my family, I was very interested in doing cancer research, and I would always look into something which is very like to save the patient's life and all of those. So, when I was in India, I was not familiar with all of these database. I wish I knew this when I was doing FAMD because the only thing we knew that can be done without IRB approval is systematic review, which I did when I was in FAMD. And so when somebody talks about health economics and outcomes research, so I am a part, I do my research in that. So it does not only include your like systematic review and meta-analysis. It is a part of health economics and outcomes research. So there are other things that comes under this, for example, economic analysis. So we are definitely good in that. We are doing really well there. And there's also a real world evidence that is a bit lacking, as you said, because of lack of awareness. But I would definitely look into different sources because all of these databases are publicly available. You just have to go there and download the data set. And in terms of your efforts, also, like you don't have to go and sit in your MRD department, get your printouts and write it down on the sheet, looking at the patient files, then go back to home, then enter the data in the Excel sheet. So this is a lot of effort. Like if somebody who is doing in the PharmD research or who is a PhD student in India, so this takes a lot of effort. Whereas here there are a lot of database, but again, I'm telling it is not only restricted to the US researchers. So these are publicly available data set and you can use it. There are few data agreements that you might have to sign, but it is not a harm to do that because it's just you are saving the patient confidentiality, and of course the data is de-identified. So using all these database and having these research in your CV will definitely like boost your CV like anything. And you don't have to put in a lot of efforts and you just have to be aware. So for every data set, there is something called as data dictionary. So if you read this, you will be able to tell what is this variable in the data set and how many responses you can get. For example, race. So how many different types of races are there? Like for the example, categorical data. So in age, some data sets give you like 1 to 5, some give you 1 to 3 and 3 to 6, like that. So you will have a complete picture of how you can use this data set and what exactly the data is. So again, it's never be scared to make your hands dirty. So use this data set. It is not like any the time and the time spent on research is not the time wasted. So I would definitely go in and explore by myself. You have a lot of resources these days. YouTube, you there are a lot of good research videos that are available in YouTube. Just get in front of your computer, start researching, and you will be definitely doing a lot better than what you can. Yeah.
Yeah, that's a good message, Zubair. And I would like to emphasize one point. I'm just taking out what you mentioned. CV. That is very important, as you know, when you
Yeah.
are especially applying abroad, you should have. So, if you are looking, if anyone who is watching this session, if anyone who is interested in health policy, outcome research, or health economics, or even policy making, that situations, I am pretty sure that the first main desirable qualification which they mention is always claim database or
Yeah.
experience in the database. Even I know that how much when we were looking into the positions
Yeah.
or exploring it, any US or not only US, even you take UK or any advanced research setting, the one key qualification or I could say a key skill which they are expecting is handling the databases. So it's very
Yes.
important to know. So fully in future we will have many researchers, and I welcome if you those who are watching or students to connect back Zubair if you have any questions on this SEER database. Okay.
Yeah.
So one last question from my side. Uh, like you said, I truly remember you were behind me to learn systematic reviews, meta-analysis, and all.
Yeah.
It's very good that we have done many works together and still we are continuing our works together. So,
Yeah.
what is the possibilities of getting these kind of stuffs published? Like in a, I know that you have done recently also you presented in ASCO. I know that very well. So, what is the publication chances of this kind of paper? So, well, like what kind of journals we should aim for, or like what should be the call it impact of the journals which we are aiming for to get these papers published?
So, talking about from the my personal approach, what I do is once I write my my manuscript. So first of all, when you start any work, we have to make sure that we are completing that work, because systematic review is not a one day process that you do from morning to evening and then you publish. So it takes a lot of planning and how you go about it. So whenever you are starting with a research question, make sure that you publish this research in a good journal. So once I write my research, I will try going with high impact factor journal first, and then coming back. So rejection is not a failure, of course. In everybody has got a rejection from good journals, no matter how good researcher he is. So you will definitely get rejection, but rejection should not limit you from publishing the results, because I have gotten a lot of rejections. So my first paper was rejected. So it is never a bad thing to get rejected. The good thing is you will get a lot of feedback from the reviewers that you can inculcate in your research, and that will basically improve your research quality. So basically, we are helping each other in improving and addressing and improving the science. So I will go with a high impact factor journal first. For example, I might aim to JAMA. I know it is very much ambitious, but definitely I would like to give a shot. And then once I get rejected from there, so most of the desk rejection, most of the good journal will be a desk rejection that you will get in 1 or 2 days. Once you get rejection, you will submit to another journal, which is less than the quality of the one that you submitted earlier. Then again, you will come back, and you will go with the less quality journal, and definitely you will be your piece of work will definitely be acknowledged in when any one of these journals. So that is how I go, and I know many of them will use this approach. Of course, of course, you might also have this approach. So this is how you have to aim for your publication. So yeah, that's how I
Yep.
do.
Thank you, Zubair. That was the best optimized means answer for that question, because
Yeah,
even last month I had a discussion with Dr. Vrinda. So it was
yeah,
on publish or perish. So we also
yeah,
discussed same points, same approach. What all of us like
yeah,
that is the one thing which I think we need to learn as an Indian researcher. Okay, I'm not
yeah,
global, because we get one rejection, we are lost. No, nothing like that. So
yeah,
the part of that, and Prunda said a good word. I still remember that word with me. So she said that every article is having a home, and that will find. So it will take time
yeah,
the home.
That's true.
Obviously, so that was a good quote which he mentioned during that discussion. I still remember. So thank you
Yeah.
so much for that.
Yeah.
That's exactly what we have to do because, as you said, research is not stagnant. It will keep moving. So
Yeah.
what we did, what we written in our paper may not be completely generalizable to everyone. So we get a
Yes.
different perspective. We get the comments in a different angle. Only thing is that we should be ready to accept that and
Yes.
our research. That's it. Otherwise, yeah,
Yeah.
research is perfect as you know. So thank you so much, Zubair. I think I could see that there are no more queries in our platforms. So obviously, if
Mhm.
I get any queries in future from through FCPI email, I can
Yeah.
forward you definitely. And FCPI team is ready to collaborate for any works. Maybe as an FCPI team means anyone in the FCPI. So
Yeah.
maybe there we are giving that platform to for your information. I'm saying we are giving that platform to the FCPA members, and if
Hmm.
anyone is interested in your area, definitely I can forward to you.
Yeah.
Okay.
I'm happy to help. Yeah.
Thank you. Thank you so much, Zubay. So we are good with
Yeah.
time. So thank you so much. I know that it's early morning, I mean around 8 o'clock in the morning for you. So
Yeah.
thank you so much spending your time with us, and hopefully in the future we will meet again with like like this kind of interesting topics maybe in the future.
Yeah.
Sure. Thank you so much then. Have a great
Yeah. Thank you. Have a good one. Bye bye.